Our study is the first study done in the United States to show that Fusobacterium necrophorum causes pharyngitis. We did the study in our student health population and found that in that population an equal amount of Fusobacterium necrophorum pharyngitis existed as to group A strep pharyngitis, and we also showed that it clinically looked just like it when using the Centaur score as a measure of the signs and symptoms of pharyngitis. This study originated with an interest in Fusobacterium necrophorum and Lemierre syndrome in 2002. I read an article in the BBC News and blogged about it in September of 2002 and became fascinated by this bacteria that had been forgotten as a cause of a very devastating disease for probably 30 years. I started following the literature and discovered that in Europe they had documented that this was a cause of endemic pharyngitis in adolescents and young adults, and interestingly not in pre-adolescents. So I wanted to do a study to see if we could understand the signs and symptoms which no one had described, as well as was this just a European problem, but was it also a U.S. problem? A lot of the impetus for this is trying to find people with Fusobacterium and see whether or not we might be able to prevent the suppurative complications of this infection. It's the most common cause of peritonsillar abscess in this age group, and Fusobacterium necrophorum is the cause of about 80% of the Lemierre syndrome, which is a sore throat followed by an internal jugular septic clot, followed by septic emboli to the lungs, brain, liver, etc. And we wonder whether or not by finding it we might be able to influence how we could prevent that. This is the first step in a series of studies that need to be done to define who has it, what does it look like, and perhaps even develop a point of care testing for Fusobacterium necrophorum. This study lays an important foundation in understanding that it is common in the United States and that it does have the clinical signs and symptoms that are similar to strep throat.